Here are 3 reasons why treating skin of color is so different and why you should see a specialist if you are someone with color in their skin. Number 1 is pigmentation. So pigmentation is broad, right? You could run the risk of something called hyperpigmentation, which is the most common thing we see when we see patients for lasers or for some type of treatment on the skin. They can end up with brown spots or spots that get darker. But the more scary thing is hypopigmentation or white spots. Those are very notoriously difficult to treat. So you really have to see someone that is used to treating darker spots and is going to use technology that's not going to increase your risk of getting darker or lighter. Number 2 is how broad it is. That term skin of color really doesn't mean anything. It can mean somebody who's of Mediterranean descent and has just olive skin. It can mean somebody who's very, very dark or has very melanin-rich skin. And so that is such a broad term. If you're from Korea, or you're from the Philippines, if you're from Lebanon, or if you're from Italy, all of those skins have very different risk of pigmentation, different risk of complications. And so it's such a broad term that skin of color doesn't really mean anything. You really got to get down to the nitty-gritty. Number 3 is sensitivity. Sensitive skin is broad as well, and it doesn't matter necessarily that you're skin of color, but some patients tend to have more sensitive skin. In my practice, my South and my Southeast Asian patients tend to have more sensitive skin than my non-Asian patients. That just is what it is in my area, so I have to be careful with the skincare I use, the chemical peels I use, the lasers I use. Luckily, I do a lot of reading on this topic. I talk to a lot of experts in this topic, and I treat a lot of patients that have melanin-rich skin. If you are a patient that's interested in this, and even if you're not and you want to learn more about it and you want to get a custom treatment plan to get you the best skin of your life, come see me in consultation. I'd love to see you.